Quick promo. Are you feeling overwhelmed about giving birth in a hospital? Well, you're not alone. My name's Colette, and I've helped hundreds of expecting mothers find their voice and confidence in the delivery room. Join me for this intensive childbirth crash course, November 4th through 6th. It's 1 hour a day, you guys. You can do it. Come live, where you're going to learn exactly how to navigate the hospital system, communicate effectively with your care team, and feel empowered during your birth experience. So whether it's your first baby or your fifth, you deserve to feel confident and heard. Don't let uncertainty stand in the way of your ideal birth experience. I know you can do it. So reserve your spot today. You can go to myfriendsnurse.com/crash course or check the link in the show notes and I'll get you all the information and get you signed up. Register right now and don't miss this live event. Hey guys, welcome back to the Birthling Podcast. I'm so excited to have you here today. I've been really excited to bring this guest on since I met her over the summer. I had been looking for someone that was an expert in the perinatal mental health space. It's actually harder than you may think to find someone that understands the mood and anxiety and depression and blues and everything that we speak of when we get concerned over mental health. When it comes to women, specifically fertility, baby loss of pregnancies or a child, and grief, and what about pregnancy? What happens if you've been struggling to get pregnant and then you get pregnant and now you're feeling some other type of way and you feel shameful or guilt or all of these things that can affect our moods and how we are enjoying life and how we are enjoying our pregnancy. What about postpartum? That's a very high risk time because our body is recovering in such a way that it can't really concentrate on too much else except our body, right? And then you tie that into with the traumas or micro traumas that can occur in the hospital birth system, and you're comparing yourself on social media and you wanted it one way and now it's a different way, or your baby's in NICU. It just goes on and on what could affect us. Personally, I had baby blues with my daughter, but that was when I was 20. But that was physiological. That could also be a thing, right? I was actually hemorrhaging and I didn't know until I got home. So no one had noticed anything while I was there. I was there probably about a day and a half after I delivered, and then I went home, and about a day later at night, I just started passing clots, really, really large ones. But that's about 3 days that I was not connecting with the baby. Did not want to do anything at all. I was kind of comatose in a way. Like I was awake and I was alert, but I wasn't feeling anything. It was so strange. So strange. But I actually thought that that's what birth was like. I'm like, okay, I just went through this major change. I am 20 years old and I was not ready to be a mom. And now this baby is laid by my side and crying and I don't know what to do. And I'm scared out of my mind. So I was trying to go through all those feelings. I was probably putting a lot on myself, just like disappointment that this happened, that there was little room for that connection to my daughter and those like overwhelmingly sweet, good feelings. I don't remember any of those. I only remember looking back and feeling like pretty awful, right? So I didn't realize, but by the time I got home and I started bleeding, and then I went to the ER and I had my surgery to get the placenta. They had a little piece of placenta left behind. And I had that. When I came to, when I woke up in not in the recovery room, but when I got moved to the regular room, overwhelming feeling of wanting to be with my baby. How is she? I want her. I want to hold her. And since that moment and on, I connected. So, that can be what postpartum blues feels like. It was pretty extreme, I think. Not quite depression, but just, feeling nothing. I felt nothing. But it was physiological. I was bleeding. My body was just preoccupied. I don't know. Just totally focused on what was going on with my uterus at that time. And I just didn't know. So take care of yourself. And I was so excited to speak to Soshie so we can learn how to plan for that immediate postpartum period. So that period right after birth in the hospital and going home, and what are the signs to look for. And maybe the signs begin in pregnancy, or you're predisposed, or you already have a diagnosis. So what things are you looking for? What is your family and your friends and those close to you, what should they be aware of? And what do we do when weird stuff happens, like birth is crazy, and how are we going to manage any of those any of the trauma, micro traumas that come with birth? So she's going to set us up for that, and then we're going into a lot of like taking care of our moms. So like asking for help, knowing the resources that we have, and being mothered, it's okay to get taken care of after this period. So she really goes into the fact that mothers need mothering. Mamas need mothering, you guys. Anyways, I'll stop talking. Let's get into our conversation. I think you're going to love it, and we'll talk about it soon after the interview. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Hey, Soshie, thank you so much for joining me today. What a pleasure. I honestly, when I met you, I was looking for anyone out there that can help me with my clients when it comes to preparing for the mental changes that we go through as women when we're going to have a baby. I was looking everywhere, and everyone I talked to, oh, I don't specialize that. I don't specialize that. And I was looking for someone in my area. So it was very difficult. But you're like literally standing next to me. And I had a great time getting to know you. Please, let's jump in. Tell me a little bit more about yourself and what brought you to this specialty, especially working with pregnant women and their families.
Yeah, so I'm a licensed clinical social worker. I've been a therapist for about 12 years, and I kind of fell into this specialty, as I think a lot of us do when we ourselves have kids, and we realize that it is an extremely vulnerable time, an extremely unique time, and there is just so much that we try to prepare for, and there is so much that we just can't prepare for. And I have found in my practice that helping moms specifically, but new parents of all kinds is really, really rewarding to get to help people through this very vulnerable, unique, and really, really special time.
That's amazing. Yeah, it really does. I think so many people I've talked to have come into this field because of their own experiences and seeing like how it relates to them and it drives them and it's a passion. Kind of happened with me, but so many people I talk to, it's the same thing. So you work out of Los Angeles, so near me, at Family Wellness Tree. Is that right?
Yeah, family tree wellness.
Family
Yeah, we
Tree.
provide. Yeah.
I'm going off of memory.
Yeah.
That's when I go wrong.
Yeah. Yeah. We provide mental health support to basically anyone along the perinatal, postnatal spectrum, people who are trying to get pregnant and dealing with fertility issues, people who are newly pregnant, people who are adjusting to maybe a third kid or, anywhere along the family spectrum. And we provide individual therapy, couples therapy, and then we also have a lot of support groups because I find that can be extremely helpful just to know that you're not alone. Whatever weird thing you think you're alone in, or you think you might be feeling that nobody before has ever experienced, that somebody is going through something similar.
Yes, exactly. That's why I do what I do. That's why we have these podcasts, and then to have one source like for group therapy is so important. And you get to know these people and they probably
Mhm.
become good friends. But so, what would you say is like the top reason, or one of a few reasons, whatever you got for me, why someone, let's say our listeners, she's pregnant, she's feeling like, I'm okay. Like, we all go through life having a little bit of highs and lows. And, we have our day to day things that we need to get through, and we're having trouble just managing that alone. And now on top of it, we have to learn about birth and this newborn and trying to make time for that. And then we're having our common arguments with our partner or our family, and people are coming to town, they want to be blah 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 blah. All this stuff goes on, but it feels very normal, right? What would be a reason or top reasons then why she would switch to be like, I need help now, right? What do you
Yeah.
see as that signal to our listener to be like, maybe I need to talk to someone? Like that would be what I would wonder, like, what is that transition? Why would someone want to come see you?
Yeah. I think one of the most common things that I hear is I'm having trouble connecting to my baby. And I love this baby so much, but I'm just not, it's not there. Or something shifted and maybe I was able to connect with them in, the first month of their life or something. And now I'm having a lot of trouble. And I'm mad at everyone, including this baby that logically I know is a helpless newborn, but I'm just having trouble connecting. I think that's probably the most common thing that I hear for new moms reaching out for help. I think the thing that we don't talk about enough is that new moms really need mothering. And it's, again, I know I've said this word a million times already, but it's such a vulnerable period. And we don't, there are so many things, again, that we can prepare for. And there's a lot that we just don't know how we might react. I'm sure you know way more about this than I do, but there's so much in birth itself that we can do our best to prepare for, and there's surprises, and we might have some big feelings about what happens in birth and immediately after. And so I think all of that impacts a mom's ability to connect to her baby. And I think every mom wants to be a good mom, and I think that's really what most people come in for, is they're thinking, am I doing this right? Is something wrong with me that I'm not able to connect with my baby, either again in the way that I did before or at all? And especially if there have been some fertility issues, then moms might be thinking, I worked very hard for this to happen and I know I want this, but there's just something missing.
Right, and that's sometimes they're thinking like, "Is something wrong with me?" Like, and then they're feeling all the guilt, and so most of the time they're coming to you after, right? And so that brings up, the question, can we dive into a little bit between postpartum blues and postpartum depression? And then we can even touch on anxiety, and I know there's OCD now with that goes along with that. Like, can we at least understand, okay, I am having postpartum blues, but is it turning into postpartum depression, right? Can we talk about like the differences between that, or when we know like we should start talking to our OB or search for
Yes.
some extra help?
Yeah. Yeah. So 80% of women have postpartum blues. So that's very, very common, really, really high rate. So many women have postpartum blues. The postpartum depression is going to be a little more long lasting, a little more intense in terms of the feelings of sadness or an inability to connect with baby. I say inability, but it might just be more difficult. Again, you probably know a lot more about the hormones than I do, but a fun fact that I remember is that at 6 weeks postpartum, there's a huge hormone dump. And that also, a lot of times, women might feel a little different, maybe a little bit better, even from those postpartum blues, or maybe a little bit worse. So I think that to me is also a big marker of time, that if it's been 6 weeks and a woman is still really feeling like, more often than not, they're feeling sad, or they're crying, or they're feeling irritable, or they just want to sleep all the time, or they have really low motivation, that is a really good signal that we might be dealing with more of the postpartum depression side of things as opposed to postpartum blues. Yeah. And then, yeah, like you said, there's all types of, there's also postpartum anxiety and there's postpartum OCD. And that, again, more common than we might think, just because it's brand new territory. It's even if it's not your first kid, it's still your body has changed in a different way, or you're just dealing with more pressure now. So you might have anxiety, a sort of postpartum anxiety with a second or third kid, and you didn't with a first kid. Yeah.
Yeah.
So
I knew
I don't,
someone that they said she had postpartum depression, and she was in her room. She wouldn't leave her room with the baby. So it was an opposite of connecting. It was like nobody else can have this baby. And now looking back, I'm like, that sounds more like anxiety. That's so she was setting up these routines and what she was doing, and it involved the baby, but she was like, you cannot touch the baby, like, so it was, it's a spectrum, I'm sure, of away from what is your normal, who are you as a normally, and it involves the whole family and able to like they were dealing with it because now they weren't able to be with this baby, and they were very worried about her, but she wasn't accepting any help or that there was even a problem. And they were suffering and they were noticing things. So it's really so important for the whole family to understand what the signs and symptoms are, so because they're probably going to notice it before you even notice it,
yeah.
is what I've
Yeah.
noticed.
Yeah. And I think that you're right. That does sound a lot more like anxiety. And I've seen both sort of ends of that spectrum of like, I'm the only person that can hold the baby, and the opposite side of things where like I can't hold this baby. Like I'm not, somebody else has to take care of this baby because I'm not a good mom, or I'm incapable of breastfeeding, or that I can't give the baby what they need, or I'm going to do something to harm the baby, which is more of a like an intrusive thought is what we call it. Even if someone has no desire to hurt the baby, that it's not something that they would ever think about. There's a thing that happens in our brain sometimes that just has this thought of I'm gonna drop the baby, or what if I just threw the baby down the stairs? Again, not because a person wants to hurt the baby, but it's an intrusive thought that definitely indicates some sort of, yeah, a need for some more support.
Those intrusive thoughts are crazy, and I didn't even know about them until Kaya, so just a few years ago. Maybe I had them when I was 20, but I don't remember, but just like you said, like, what if I just fell? Like, holding her at the top of the stairs, what if I just fell? Or what if I like, crazy things, and now that I knew about it, every single mom that I talk to is like, yeah, they get them too. And it's like, okay, this is very common, and it can scare you can scare yourself. You're like, why would I even think this? This is not something I would ever act on or do it, but it's so scary. It's
Mm-hmm.
like, I like to think it's because you are experiencing a level of love that you have never had before, and then that will correlate with a level of fear, and then your body's just like, what would happen if this happened? And you're just like crushed and you're like scared of yourself. This is just me like theorizing, because it's just like, because it comes from a place of like insane amount of love for this thing, and you're just like, oh my gosh, what happened? And it flashes, it comes and goes, and then you're like, oh, let's sweep that away, and then you go on with your life, right? It never affected my day to day. It never caused like anxiety about it. It comes and goes. So these intrusive thoughts are intrusive because they they come without warning and without your permission, and then they go. So, yeah, if you get these, if you're listening and it happens, you can talk about it. Other moms, you can talk to me, you can, and get it out and understand that you're normal. This is something that we all kind of go through. And I think we've gone through it in secret for a long time, but people are starting to talk about it more, which is so great. Yeah.
Yeah, I think you're totally right that we've gone through it in secret. And I think it's also been very stigmatized. So I think if there's one sort of piece of advice that I can offer to your listeners, it would be to make sure that you have some circle of support, especially in providers. If it's an OB or your baby's pediatrician or your labor and delivery nurse, whoever it is, somebody that you can say to, I had this weird thought, I don't know if this is normal. Or just, I had this weird thought, it seemed weird to me, but I don't know. And someone who's not going to judge you. And I think that's just really, really important, especially in the postpartum period.
Right, right. So what can we do then? We're pregnant and like we're fine, we're going through life. What do you have any advice? Like what could we do now to kind of set us up for those first 6 weeks, right? To make sure we call it the fourth trimester, to make sure that we can maybe reduce the risks of postpartum depression or anxiety, like what kind of support system we have. I know setting routines is really important, but what would you say? Like, we're pregnant now, we're a little worried. Maybe we have some risk factors, right? Maybe we have had a history of depression or anxiety. And what could we do then, you
Yeah,
think?
yeah. I think sort of, I'm going to say two things that seem to sort of conflict with each other, but I'm going to say one of them is just plan as much as possible. And then the second thing that really conflicts with that is recognize that as much planning as you do, things might fall apart, and that's okay. And so I think that the two things that I really like to think about in terms of planning are sleep and food, because those are two things that are very hard to come by in that immediate postpartum period, especially sleep. I remember like one of the very weird things that happened to me that nobody told me about was the night sweats. Like in that immediate postpartum period, apparently it's a hormonal thing, but the sweating would wake me up, if not the baby. So there's just all this weird stuff that is gonna might stop a new parent from sleeping. And of course the crying baby in the middle of the night. So I think planning for what is my sleep plan? Is it that, and talking about these things with a partner, or if there's someone else who's can be a supportive person to a new mom. Maybe it's a parent or an in-law or a friend who has offered, like, I can be with you for the first month or whatever. So if it's, I'll do the first night shift and then you do the second night shift with the baby, thinking about where can I sleep so that I won't hear the baby crying again, if they're knowing that there's a trusted person around who's going to address whatever the baby needs in the middle of the night. Those are the kinds of conversations that I strongly encourage pregnant women to have, again, with their partners, with whoever is going to be supportive. And then around food, sort of similar conversations. If it's like, okay, we restaurant delivery, we're just going to do Uber Eats for the first 2 weeks or whatever, or having someone set up a meal train for you. Those are maybe it's again a mom or an in-law who has offered, like, I'll make sure that you are fed. Really taking people up on those kinds of offers. Again, it's a vulnerable time, and so any offers of help, you might want to really think about that. All of that being said, also recognizing your own boundaries. So maybe it's that my mother in law is going to be great to bring food by, stop by for 10 minutes, and then she needs to go. And, I don't want my mother in law around for, hours on end or whatever, just as an example. So really knowing, like, who you can accept help from, asking for help, and also maintaining your own boundaries. And as I'm saying this, I'm thinking like, oh my God, it's so much to put on a new parent. But I think that goes back to the idea that why planning is really can be really important. just thinking about these things, having these kinds of conversations with a partner or some supportive person. This is what I envision for for the first few weeks of my baby's life. Is there something that I can rely on you for? Can you come over and do my laundry? Whatever it is, asking for help and maintaining boundaries, I think is going to be really important in terms of planning.
No, you're absolutely right. I've talked to a few people, even on this podcast, like Melanie, she's a doula. She does newborn care and she's like a postpartum doula. And she was saying, start setting routines, like start taking walks in the evening now during dusk with this, like use the sun, go or first thing in the morning, get that first sunlight and do that while you're pregnant. So you're getting exercise and sunlight. You're setting up some expectations around your meals and your sleep and really prioritizing getting that routine down now so that it's more like a habit when the baby comes, because when the baby comes, you know like you said, it's things hit the fan and things happen and you're like, whoa, I wasn't expecting that. But you don't want the unexpected to be the things that you could have prevented in the first place by just making a routine or a plan, right? We need to set some expectations with our family and our partner ahead of time, because at the time of is not the time that you're want to be like, okay, this is it, what's happening, this isn't working, now we need to shift and figure this out. And now you're having these maybe difficult conversations, like a mother-in-law conversation with your spouse, and that can be touchy and you're already feeling anxious and hormonal and then maybe pressured to just go along with it, and you're so tired, and then it's just going to be like this mountain and this buildup over you of stress that could have been prevented if you just had this plan ahead of time. And so I always say, just like with birth, you don't want to go in just winging it to postpartum either. And so you have to prioritize your own health, but also your mental health. Right? Even in the hospital, like I'll give an example. We had a friend that her baby went to NICU, right? So her whole postpartum period, she was alone in her room. So she ended up every moment she could going to be with her baby in NICU, but she then sacrificed her sleep and shower. She didn't shower until she got home. She put everything aside that had to do with her because she just had this urge and this need to go be with your baby. But then so then I'm like, I stress in my course, I with my clients, like, I understand that, but you're going to be there for your baby so much better. The quality is going to be so much better if you do prioritize your own recovery and your health. So that means your sleep and your eating and you're showering and you're putting on fresh clothes. It could be sweats. You don't have to dress
Yeah.
up. You can take a shower and then roll your hair up in a bun. But like, you don't have to get all fancy,
Right.
but it makes a huge difference. And
Yeah.
I think you probably know, like in our culture, like you see moms and they're kind of like, oh, I haven't taken a shower in 2 weeks and I can't sleep. And it's like almost the norm to
Yes.
see other moms like that. So you're like, I guess I'm doing it right, but I'm suffering. You're like, no, that doesn't need to be the
Yeah.
norm. Like, you have to make the plan and set expectations with your family, your friend. Like, I'm going to shower every other day, or every morning,
Yeah.
or whatever you can get, maybe every 3 days, whatever it is. And I need to sleep. There needs to be a 5-hour stretch where I'm sleeping. How can we make
Hmm.
this happen?
Right.
Right. And your partners too have to take care of their own health and their own mental well-being, right? It's a
Yeah.
whole
Yeah.
family thing that we're dealing with.
Exactly. Well, and I think that you really touched on something that is a soapbox issue for me. I think especially in our culture, there's a real value for worse. This is not a good thing, that we seem to value independence, and again, fine, at some points in life, yes, that's a good thing. But I think in this postpartum period, in the pregnancy, delivery, postpartum period, all of that, we can't do it alone. We weren't meant to do it alone. And I think we do need other people. So yes, prioritizing and making a plan for sleep and food and being around, and hygiene and being around other people. Isolation and loneliness are also huge risk factors for all those things that we were talking about before in terms of even baby blues and postpartum depression and postpartum anxiety and OCD and just not feeling great generally. So I think just also making a plan for who can be an emotional support person for you is also really important.
So important, so important. I think there was a reel that I saw. Well, I made a comment. I'm in a big stink because it was like the dad was like, "No, we can't have anyone over. You know, the baby doesn't have his vaccines, and we need to just take care of your health, and we can't have all these people here." The mom was like, "But like, you know, I want this person, or what is this?" And I was like, "That's so sad." And
Yes.
everyone's like, "Yeah, no,
Yeah.
you don't need all these people at your house, and you need to set your boundaries and blah blah blah." But there's a fine line there, right? Where I get it. We want to set it. We don't want, you know, all our neighbors over and our friends over, and they've just been partying, and now they're bringing over some germs, and you are in a vulnerable time in your life during this period. So you do want to be very careful of who you have in your inner circle during that time, but do not isolate yourself. Make a plan for those people, those trusted people in your family. Um, if you're lucky to have those kinds of people, and if you don't, then you may need to have to search out for a community of new moms. And they have like Facebook groups and Peanut app and different areas you can actually go out and start talking to new moms. And maybe it's not in person, they're not coming to your house, but even if you're just like in your messages or on, you know, posting things on your ex account or whatever you do, just like, "Hey guys, like this is what I'm going through." And then you're going to have boom, 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 all these responses of women that are going through the same thing, and you're not going to feel alone. So just making sure that you're not isolating yourself in that way. It's, uh, you know, in mental, my mom is going through a really rough time right now with her mental health, and isolation was the biggest downfall for her during COVID. So it I'm sure you know, just like isolation is awful. And so to promote this kind of independence that we do in the United States, where normally it would be such a community event where people would be coming over and leaving food for you and taking care of you and the baby. And you know, we have we have to mother the mother, right? We gotta take care of
Exactly.
you,
Yes.
and you have to be able to go against that like urge to be independent and accept that help. Right, and
Yeah.
so
Yeah.
mm,
And like you said, I think everyone's goal is to be the best mom possible
yeah,
and for that our kids need, and I have a lot of other thoughts about that.
yeah,
But if we want to be the best mom possible, we need to find ways to take care of ourselves
for
first.
sure, for sure. I had one like a friend, she said, "Oh, well, my mother-in-law's gonna come. She wants to come stay, but I don't know, and it's gonna be like, I don't feel so comfortable with her, and blah, blah, blah. Maybe I'll just tell." I'm like, well, don't don't close that door. Like, don't shut it.
Yeah.
Like, keep it
Yeah.
open. But instead, start a conversation about, well, what exactly do you think you would be able to provide during that time? Like, start getting specific, because if you don't, then in your head you're going to think, okay, she's just going to come over and maybe play with the baby or blah blah blah, and then she's coming over and taking over your kitchen and doing all these things that you weren't prepared for. And you're like, now I'm feeling like, I just want her out of my house, because there was never a conversation, and everyone comes in with the best intentions but with different expectations, right? So you need to set your boundaries, and you need to have those tough conversations. And they don't have to be tough. It can be like, "Oh my gosh, I'm so happy that you want to be part of this and help us out. Let's talk about exactly how you see that happening. Like, what are your strengths? What can you bring that will help you, like, have some, like, know what to expect." And
Yeah.
then you can say yes or no to those things, right? If you're okay with it.
Right.
But don't ever shut the door to people that want to help. Just ask
Yeah.
them what do they have in mind, right? And then
Right.
maybe you can
Right.
fit it in. But if you don't, you're like, "Oh, thank you. Yeah." No, if someone's like if you have a friend that's like, "Hey, if you need anything, let me know." and be like, well, what did you have in mind?
Yeah.
Like,
Yeah.
tell me.
Totally.
Like, well, what do you want to do? Like,
Yeah.
put them on the spot. They're like, I could bring you lasagna. And you're like, perfect.
Great.
Do that.
Yeah.
Like, don't just,
Yeah.
I have so many friends I say that to, and then they're just, or back in the day anyways, and they're just like, oh, thank you. Yeah, we're good, but thank you. And they shut the door on that. And I just say, like, well, if they need me, they'll call. And they never do. And they just kind of suffer through it. No, if someone asks you for help, it's like, okay, well, that's awesome. What can you do? And then have a couple of things ready. Like, well, I'm sure we're gonna maybe need a meal or two. Would you be able to do that? Or do you have any resources, like a referral to someone you need, like a masseuse or whatever you want to do? Like, don't shut the door. Get your community, right?
Yeah. I like to think also that those kinds of conversations in advance, they also give you sort of permission, because again, we, especially as women, are kind of socialized to be a little more permissive, just take, a little less assertive, a little less
You
direct.
don't want to bother
As
anyone.
Exactly. We don't want to be a burden. We don't want to bother anyone. We don't want to be rude. And so, if we do have those conversations in advance in terms of the planning, it also later on, we can go back to those conversations and maybe say to our partner, this was not what we talked about, and this is not what I had in mind, and this isn't working for me. Or go back to that friend or the mother-in-law or a sister or whoever it is and say, we talked about X, Y, and Z, and it doesn't seem like that's happening, and I need this to happen. Or it just, we've set the stage so we can sort of revisit it and be more direct, be more direct. At least that's what works for me a lot of the time, is
A
to
thousand
go back to
percent.
that.
A lot of the things that I do coaching clients, believe it or not, are learning communication tools. You wouldn't expect
Yeah.
it. I'm preparing you for birth. And so
Right.
much of that is learning how to be a leader, right? So I've read so many
Hmm.
books on leadership and how to be a boss and be top the top honcho where you're directing people, because you are. This is happening to you, and your
Right.
partner needs to be involved in that if you're lucky enough to have a great partner that can be your, right hand man, like literally.
Hmm. Yeah.
Right? But you need to come to the room as the director. And that doesn't mean you have to be a bitch, that you have to be like da 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 or yelling or screaming. It means that you need to be somewhat organized and set expectations, but learn how to communicate, and then also learn what everyone else has in mind. Like, well, where are you at? Like, what are you thinking I need or that you could do the best at? And then and there you're by doing that, by just having that conversation and learning those skills, right there you're setting the expectations with them. Like, if anything's happening, I'm going to also have another conversation. Like, we're going to get through this. And instead of this being this whole big thing that is now causing you this internal anxiety and pressure, and now you're feeling like a bad mom because you can't juggle everything, but you're also not able to accept this help that you know that you should, then it's going to only make your mental health suffer more. So you have to learn communication skills. You have to learn leadership skills. Believe it or not, a large part of having the birth you want is by kind of unlearning what you said, which is that being more submissive or just going with the flow. Or so many moms I labor with just don't want to cause any issues. They also don't feel they know enough to even stand up to the doctors or ask deeper questions. Right? They're just not the leaders in there. They're just like handing it off because maybe that's just how they were raised or how our society has steered us women. And then we have these, paternal, like these patriarchs of doctors and the hospital system itself, including the nurses, coming into your room acting like we're the authority in this. And you're going to do what we say because we know best. And that even puts you more into like, oh, wait, okay. And now you're having these like micro traumas. That's what we call it. I don't know what you call them, but it's not like you lost all this blood and then you went to the ICU and it's not by any like means of the story a traumatic birth, but it is even just having a
Yeah,
birth where it
definitely.
was rushed or you felt like your voice wasn't heard or you lost autonomy of your body with people just rolling you over and it felt like you were in like some massive accident, but you were just giving birth to your baby and then maybe you weren't able to hold her right after birth and that can affect you. That those are micro traumas that your body holds on to, right? So let's talk a little bit before we finish. Like, I just want to talk about that because I talk about it all the time about these how we can create the birth we want is through leadership, through communication. But little things happen, especially in birth or postpartum. How can we talk through that? How can we get through these if your birth didn't happen exactly how you wanted, if your baby went to NICU and you weren't able to get that golden hour, like, how would we be able to talk to ourselves or talk to someone else about those and get through that? Do you have any
Yeah.
suggestions? I know I just threw
Yeah.
that
I mean,
on
I think
you. I just can't.
no, I think but I think you sort of just said it even right there, just talking about it.
Mhm.
I think one of the
Yes,
things, and I sort of said this a little earlier also, that we can plan as much as we want and have all the wonderful conversations and be a great leader and for ourselves and our babies. And then the universe has other plans. And so, how do we then deal with that and whatever feelings come up about? I mean, really, what we do a lot in the mental health world in this field is grief work, because there's so much grief in that, and disappointment of, I didn't get the birth that I wanted, or I didn't get that golden hour, or just all of, there's so much there. And so, yes, there's a lot of grief that comes with all of that. And the best medicine for that is to talk about it, and to, maybe it is with a therapist, maybe it's with a friend, maybe it's with family members that are reliable and trustworthy. My son went into the NICU very unexpectedly, and I found, after that experience, I was talking about it with this person and that person, and after, a little bit of time, I realized that everyone had a NICU. Like, all these people that I didn't know before had experiences with the NICU. And there's something that is just knowing that there is someone out there who knows what your experience is. And again, maybe it's a therapist who, has an unbiased approach and can really just be in the muck with you, and just listening and being right there with you. That in and of itself is so powerful, and that is really sometimes what we need.
for sure. Yeah. And I love that it's less stigmatized now to see a therapist. Like, it's everyone's seeing a therapist now. So it's like, I'm gonna go see a therapist. Okay, great, cool, good for you, good for you. It's not so, and having all these thoughts, and maybe that's because of social media. We're so connected now that we're able to tell our stories easier, and you don't feel so alone knowing that it's out there. So I'm glad you're listening to this episode and that you get to touch on the fact that you're not alone with these thoughts and these feelings, and that there's things that you can do to lower your risks, right? So we said set a
Definitely. Yeah.
routine, get your sleep in order, get your meals planned, and try to find the things that really bring you joy and make you happy, like your favorite TV show or movies or area. I always say, like, create a little area in the house that you can go to that just is specifically to connect with your baby. So sometimes that's the nursery, or sometimes that's a place in your living room that you can sit and read a book. Or I always say, like, learn a lullaby and like start that bonding and connection while the baby's still in utero. And then the transition might be a little bit less like, well, like switch, right? And then understand that
Right.
hormonal drops and changes are going to affect your moods, and just surf through it, like get through it by communicating, setting expectations, and prioritizing self-care. So getting that sleep, taking those meals, and finding place and time to enjoy your partner. Don't forget about that, and your friends. And I always tell people, like, don't forget who you are before becoming a mom. I feel like for me, it was losing that sense of identity. All of a sudden, you're like thrown into motherhood, especially if this is your first time. And if it's your second or third, that's a whole nother ballgame because now you feel like torn between these two babies you need to take care of, or these kids, or in the challenges of multiple schedules and all of this. That's a whole, I need to do a whole nother episode just about that. I swear. But
I
just
have some
not
things to
losing,
say about that
yeah.
too.
Yeah, just not losing who you are, like, as a person. So, like, if you need to just take a
Yeah.
night and go out with your girlfriends, maybe go to a show, say see a band that you used to love, or go to something I used to do that reminds me of who you are. That means some for some women, that means, like, maybe going back to work earlier than you thought you would want to. "No, I'm gonna be at home for 6 months," and then you're like, by 2 months, you're like, I'm not doing well. And maybe the second you get back to work, you're like, oh yeah, I'm good at this. Like, and everyone is so individual. So every person is going to be a little different on what that looks like, what your routine looks like, and what it looks like to feel better and find that, right?
Yeah. Well, and I love what you're saying about it being so individualized because every person is different. And so I think a lot of what we do in the mental health world in this field is to help people to figure out, yeah, did I lose myself? And what do I need to do to feel like myself again? Or just what are the things that I can do to help myself? And yeah, it is so individualized. There's no cookie cutter answer, unfortunately. There's no like one Instagram account that can give us all the answers, unfortunately. So yeah, it's just individualized, and we get we know, I believe that everybody knows the answers for themselves. They're just deep under there somewhere. And so that's where
The
the
therapist,
talking
bring
can
it
really
out,
help.
bring it out. Yeah, yeah. What was I gonna say? I was gonna say something. Oh, do you think, like, you mentioned grief, and then I mentioned, like, losing yourself, like, there's maybe there's a bit of grief of losing that's, you maybe you got married and now your family, you're like, I'm kind of missing, or I'm grieving that woman that I used to be, right? That single, like, carefree, whatever you were doing. I was like, and you wanted, and that goes along with if you were like family planning. So if you were going through IVF, or you were like really trying to get pregnant and you wanted it so bad, and then it's like this guilt, like, why am I grieving? Like, now I have this baby, I should be happy. And now I'm feeling guilty because I'm not, because yeah, you're going through a little bit of grief, and that means talking it out.
Yes. There is so much grief in parenting, and especially like within the in the beginning of parenting, and there's so much grief. And I'm not talking about the kind of grief, maybe for some people it might feel like the kind of grief that they can't get out of bed. And for some people it's just a grieving a period of time in their lives. And think about it, like the when you are with your baby out growing out of the newborn phase, there's also some grief in that. That's a can be a really sad thing that you're saying goodbye to that phase. And yes, there's a lot of joy in moving on to the next phase, but that just continues to happen as parents.
Oh
And
my gosh, it's so true. Like,
yeah.
my baby's in preschool now, and I'm just looking at her. I'm like, she doesn't have a baby body anymore. She's like, I went and got size 4T instead of 3T, and I'm at Target like, it's
Exactly.
every step of the way
Yeah.
because you're kind of losing your babies, like, as they keep growing. And then, of course, you're just like, oh my gosh, but you have all these firsts, and she's able to express herself, and you're seeing her little talents. And, it's like you said, it's so much joy that makes it worth it. But you can accept the fact that you may lay in bed staring at your baby and be like so sad.
Absolutely. Absolutely.
And
Yes.
that's okay, and we get it.
Yeah.
You can talk about it, accept it, let it pass
Yes.
through you. I am not a grief expert by any means, so you have more to say about that, but
Yeah.
I know it's
Well, it's
true.
also there's no other experience in the world where those two things can be happening at the same time, where you can have this like intensely joyful experience of like, oh my God, my kid she just vocalized to me how she's feeling. And also I'm buying 4T clothes and that's so sad. And I want my baby back. Those are, it's so strange. And so I think that's also, that's where again, that talking with supportive people can be really helpful.
Yeah.
People who understand.
And remembering who you are and what your life is, because your kids, you it's just part of it. And if we start making their kids like our whole life and our whole identity, then that's going to be even more sad, I think, as they get older and we're
Mhm.
like, wait, who am I again? So keep your
Right.
friends close, keep your identity like what your passions, who you are, what you love, your music, your whatever it is, your partner.
Yes.
Make sure your partner like
Yeah.
prioritize, if you, like I said, if you're lucky enough to have a great partner, prioritize that relationship. And yeah. So last
Yeah.
question, real quick.
Yes.
Like, so I usually say speak to your OB if or your midwife if you're feeling like your postpartum blues are lasting a little longer, or maybe you're pregnant and you're having a lot of stress, and they're usually like, okay, talk to your OB. Is that correct? They go
Yes.
first to their OB and then maybe they'll refer them to someone, and
Yes.
like a psychiatrist
Definitely.
for medication or a therapist for talk therapy.
Yes, OB is a great place to start. In some of the bigger hospital systems, you actually end up seeing your baby's pediatrician before you even see your OB,
Oh, yeah,
like when you're discharged from the hospital.
very
So
true.
I also say pediatrician is a great place to start. And in some big hospital systems, they actually do some screening for postpartum depression for the moms at the baby's first couple of appointments. So that's also a great thing. So, yes, pediatrician, your OB, midwife, doula, whoever, your partner, a friend, just anyone that you might, even just to say, I think I'm struggling and I'm not really sure what to do.
Right. And
So,
don't
those
be
are all
scared of those
great.
assessments either. Like, oh, I don't want to come off like I'm sick, or like they're going to have different consults. So there's an Edinburgh scale that we do in the hospital. We screen you when you first get admitted by asking a few questions. They're very simple questions like, do you have a history of anxiety or depression that you've been diagnosed with? Or have you ever had thoughts of self harm or suicidal ideation? Like, have you ever thought of killing yourself? These are very deep questions that we throw at you, like, hi, my name's Colette, I'm going to be your nurse. Have you ever tried to kill yourself? Like, literally, that's
Right.
how it feels like sometimes. And I always tell them, I was like, okay, if other people in their room and this is like an awkward situation, you have to answer these questions. If you feel more comfortable to say no, go back to when you're alone or you get some time alone, then you can go and tell her the truth. She's not there to hurt you. She's not there to send you to child protective services or put you on medication. But we want to know what your risk is for getting postpartum depression or anxiety or CD, and get you to the right people that can help you. And it doesn't mean you will. It doesn't mean that you're going to, but your risk goes up. And that's what we're trying to do. We actually ask these questions to every single person that comes through the hospital like doors. We ask these questions, so you're not being singled out when we ask them. And a lot of nurses will wait until you're alone to ask these questions. Some nurses don't. They'll just ask you and they'll like look at you. Some laugh about it. Like, I know this is crazy. It's not. It's not crazy. We don't want to miss you. We don't want you to fall through the cracks. So we ask these, and you'll be like, no, I'm fine. Or like, you'll look at me like, oh, I don't know if I want to answer that. And then later on, after you deliver, we give you the Edinburgh scale, which is just a simple piece of paper with like, you know, on a scale of whatever it is, what is your level of enjoyment of life, or whatever the questions are. answer
Right.
answer truthfully. There's a score that we give, and then we can escalate, maybe getting someone to come while you're in the hospital to have that consultation, to sit with you and talk to you about what your concerns are, what your fears are, what your history is like. Remember, it's so individualized. And then from there, you'll probably be able to get an appointment or move that quicker than if you try to lie or just ignore the facts, right?
Definitely. Yeah. I would say best case scenario is you you fill out those surveys and it's flagged, and you're referred to a therapist or a social worker or somebody to talk to, and you talk to that person and they're sort of like, you seem okay. Right?
Yes.
Like, I
Yeah.
think this seems like a phase thing. Let's check in again. Like, you don't seem to need ongoing support. But again, I guess I'm also advocating for honesty
Honesty.
on all of those reports. Yeah,
100%. Where no one's trying to take your baby away. We're not going to put you in this category of unfit mother or less than by any means. We sincerely just don't want you to fall through the cracks and wait until it gets
exactly.
so bad. Like if there's it,
Yeah,
like you're just going to be on their radar now, and they're going to be able to offer you things that they wouldn't have been able to offer you if you just try to push it aside or lie about it or downplay it, whatever it is. Ask questions. Go in like, well,
exactly.
I'm not answering any of these questions, like I feel pretty normal, but like what would it look like if I did start, like what if I go home and I get like, what should I do? Should I talk to my, and then that's communicating. That's bring it up. You may already know the answer because you listen to this podcast or you work with me or, you work with Shoshie, but now you're bringing it to their attention as well and asking more people and really talking about it and seeing who might have the answer. Because, right, we're so individualized, and so that's what I always say. And see what's out there for you. And if you need to get a therapist and you're in the LA area, you can always try Family Tree Wellness. Do you ever you do Zoom and online? Like, do they have to be in LA?
No, nobody has to be in LA. We can only see people in the state of California. So we can see anybody in California, familytreewellness.org. You can even book an appointment right there online. So it's all very easy.
Amazing. And then you can follow her
Yeah.
on social media at it's
Yes.
Family Tree Wellness, right? And underscore
Yes.
after that.
Exactly.
I'll
Yes.
put that in the show notes too, in case anyone's like actually reads those. We'll see. But they'll be there for you. Family Tree Wellness. Soshie, it was amazing. Is there I always ask if there's any final word you want to say to the listener, leave him with? I know it's kind
I
of
don't
put you on
think
the
so.
spot.
Yeah.
Yeah, we
No,
went
no,
over a
that's
lot of
fine.
stuff. Just
Yeah.
know that she's there for you and that you know what? It was really hard to find someone that specialized in it. So you may want to start looking for someone now, even if you don't
There you
have,
go.
like, find something like Family Tree Wellness that's in your area. Like, what could I go out and look for? And you may never need them, but it was tough for me to find.
Yeah.
And now that I found you, I actually found a couple more after that. So I'm like, okay, but they're not really advertising. It was really tough. So put in the
Yeah.
work a little bit right now, just so you have those resources ready to go. Go visit her website so that you know what you're looking for in her social media, and then just have that plan and ready to go. Because there are people out here that really, really know
Yes.
and really want to help you to make sure that transition into motherhood and parenthood. And this goes for men too, because men
Hmm.
go through these hormonal changes and the grief of losing who they are and then having a partner that's changing. It's all tough,
Yes.
right? So don't leave your partner out. He may be going through things as well, or she. So we want to all be a team on this,
Yes.
in this new
Definitely.
adventure that you guys are on. So thank you so much,
Yeah.
Shoshie. It was
You're so
amazing. I'm
welcome.
excited for the
Yeah,
masterclass
this
that
was
you're gonna
fun.
do with us. And yeah,
Yeah.
we just are so happy that you came.
Yeah. Thank you for having me.
Thank you too. Bye.
Bye.
Guys, I really hope you enjoyed this interview today. I had a fabulous time with her, and I was so happy that she was able to come to the masterclass as well. So I hold masterclasses now once a month with experts in the field, whether, and a lot of them have come on the podcast actually. We did a twofer. So you got that little tease. But if you are interested in working with me, having group calls with me weekly, speaking with our experts during the master classes and hearing what they have to say just to you, talking with me, speaking with me one on one, and getting my full course, 9 modules. Guys, you're always invited to come speak to me and see if we're a good fit to work with each other and help you navigate the hospital system and pregnancy, everything you need to do to prepare for your postpartum and newborn stage and recovery. Everything, girl. You need a friend that's a nurse. That's what I'm here. That's why I named it this, right? My friend's a nurse. It's my business, my baby. And it's all about you at the end of it. Like, what can I do to serve you? I know I have it listed out. I know exactly what to do to serve you, but everyone's different on their needs. So if you're interested, email me, find me on Instagram, all right? Colette at My Friend's a Nurse, or on Instagram at My Friend's a Nurse. You know where I'm at. Send me a message. Let's talk. And, I love what Soshie said today about mothers need mothering. And I needed it. I needed my mom. And you guys need maybe it's not your mom, but if you just need a friend that understands and will listen, and it doesn't hurt that she's an expert in labor and delivery, I want to be here for you too. You deserve to be mothered. You deserve to be heard, and you deserve it all, girl. So I'm here. Next week, join me, and we were going to start getting into the baby medications that we give right after birth. So we'll start with the big one, vitamin K. Why we need it, what the evidence shows. I mean, it's pretty controversial. I'll let you know that right now, so you won't want to miss it. All right? Bye. Thank you for listening to My Friend's a Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.